So it gives me a lot of immense pleasure to actually interact with you and with TSL and of course with Adipo family. So my name is Dr. Danny and I am an Ayurveda physician basically based out of India. I am a part of TSL and also Adipo. So this Malaysian center is like my second home now. So because the kind of people here, the kind of patients and the kind of responses that I've got over 5 days, it was very encouraging. So that's the reason we are here now. So thought of just sharing some insight, something what I know or what we have been experiencing over the years. So just a very informal kind of an interaction. So please don't be scared that I am not a teacher here. I am just trying to interact with you. It's a very interactive session. So we will try to be as interactive as possible because I don't believe in a one-way communication. It always has to be both ways, right? So shall we begin? Okay. So today we'll be, I represent TSL Nutraceuticals. Basically, we are a Singapore-based company. So the topic here is the path to healing, exploring natural solutions for chronic health problems. Okay, that is the basic problem and how we can see, how we can correlate the natural system of healing with the current problems, and that how to address them properly. That's the whole idea. Right? So a little bit about TSL, what we do, basically based out of Singapore. And to 2016, we formed this company. And of course, we import and we distribute a lot of nutraceutical products across. And these medicines have been proved very, very effective, for various reasons, for various health reasons. And the idea is the whole thing that whatever we promote and whatever we produce and all those things, those medicines or supplements has to be the top of the quality because it is very, very imperative because a lot of things goes away. Today if you see that a lot of MLM things are happening, so we don't want to be in that particular league. All our products are, they are not on an MLM type, but it's more on a prescription-based medicine because until and unless, our team of doctors see the patient, examine them, these products will not be out. Without prescription, these products will never be out. Because we want to have a control over that, so that it should not be, utilized in a negative manner. That's the whole idea. Of course, about myself, I've been practicing like it's 19 plus years now. So I've got a company back in India. And what we started off with, during COVID, I started with a telemedicine facility and we have just extended and the family is ever growing. Last June, we started in Singapore with just one patient. And I'm so happy that here at the moment, as on today, I have 212 patients on rolls. So the first patient started with Singapore, 100 patient happened here in Malaysia in February, and another 100 added in a period of just 4 months. So it took us 8 months to come to 100, then 4 months to achieve this 100 figure mark. We are growing very, very fast because we want to take healthcare right to the consumer. So even if the people are not able to come here, I can reach them through our telemedicine portal. Medicine and all those things, how those things will be coming, I'll explain in due course. And I'm also an advisory member with the American Ayurvedic Certification and Credential Accreditation Council. It's a organization which is based out of US. So they do therapist training and all those things. So I am like an executive, advisory member. What are the companies that we work with? Adipo Labs, as you already know, that we are working with Adipo Labs. Welcome, doctor. How are you? So BioV is, nutraceutical brand, which we, it comes under all, we have nutraceutical products under that particular brand. We do the R&D, manufacturing, distribution, everything there. Then another company which, it is my parent organization. It was my parent organization. I was the general manager for almost 7 years. That is where me and Mr. Allen, we started our journey. So I know him from there. Avian Ayurveda Formulations, they are almost in India since 1930. It's a very traditional Ayurveda hospital and Ayurveda firm that manufacture almost like 400 plus Ayurvedic products. We have also tied up with Amipro Labs, which is Dr. Ashraf Ali. He's based out of University Science Malaysia. He's in Penang. So this gentleman has almost like 400 products registered under his name. Those are all very researched, products, which are traditional products as well, and there are cosmetics, there are a lot of other things. Basically, he's he's a doctorate in pharmacy, and he has been headhunted by the Malaysian government, brought from India. He was the ex-director of Ranbaxy, and he has got very, very high quality products, which now we are trying to help him. He's trying to help us in seeing patients like autism, dementia, Alzheimer's, and all. So these are very good products which are available with him. So we are trying to do something together so that the quality of life of people here and the patients, we can make it better. That's the whole idea. What all we do, as I told you, like we have a telemedicine facility, almost 200 plus patients as on today. It's not just 200 patients. I like to call them like 200 family members. Any patient who is coming to us, we don't treat them as patients, somebody who is sick and ill. We make them a part of our family. So our family is growing every day. So every day we have a new member addition in our family. And allopathic consultation services, because we have oncologists who are on panel, because when we are dealing with cancer and all those things. Ma'am, please be seated, ma'am. Okay. So we need, when we practice integrated medicine, so as far as Ayurveda is concerned, I deal. And nutrition, my colleague Krishnendu will be dealing, and then of course the oncologists, they will be dealing with with cancer and cancer patients. So we get a lot of referral. We do a lot of referral in that way. Then of course we manufacture high quality nutraceutical products. We do medical tourism also, because it's not only Ayurveda tourism that we actually follow. We have allopathic hospitals also on roll. So I take care of them in India. So in Chennai, we have one hospital. Gleneagles is there in Chennai. So Gleneagles we have tied up formally, and also in Cochin with Aster MedCity, that's also a very good hospital. So any person requiring any allopathic intervention, so surgery or any sort of implants, all those things can be taken care of in India as well, because the healthcare cost here in Malaysia and Singapore is very, very high, and some of them are not they are not covered under the insurance. So they can definitely come and take the reference, and we can actually help those patients to get the best quality healthcare services there in India. And I usually visit the hospital and see to it that, I personally visit for my patients there. So I'll be there with the hospital, I go take care of them, and then I'll meet the doctor and all, we'll have a joint consultation, and then the patient is hand-holded there. Okay. Other Ayurveda hospitals, so we have some very good hospitals in Kerala, Somathiram, Sanjeevanam, all. So we have these hospital tie-ups. Our center, this is our Singapore center, which is there on McTaggart Road. And then we have tie-up in Malaysia. So Adipo is there. Of course, IoTouch is another center coming up in Johor. Madurai is my hometown, so I'm based out of India. So my Madurai is there, one center. Then of course, we are now exploring potentials in US. I've got a very good friend, and now he has offered me, he was so kind, he offered me an office space. So we'll be now slowly expanding into US as well, where we'll be sending our products, registering them, and of course I'll be doing a teleconsultation there. So likewise, how we did it for Malaysia, we will be doing it for US as well. So presently our team is a very small team right now, but big dreams. So I am there, Dr. Damodaran, he's our consultant oncologist. Then Krishnendu is there, she's our nutritionist. Then Dr. Sudha is another oncologist on our panel. And then I have my friend, Dr. Johnson. He's a diabetologist. So he's based out of Madurai. So his photograph is not there because he's still working with the government sector. He said, don't put my photograph. Otherwise I'll be flagged there. So I said, okay, I'll keep it a secret, but let it be an open secret, I say. So what specialities? Basically what we have done is we are working very closely with Adipo Labs on hypothermia. And we are working for cancer and cancer treatments, because we ourselves have come up with a natural plant-based medication for cancer, which is given as an adjuvant for a person taking hypothermia as well as chemo or radiotherapy. So we are working with the doctors, with the onco, with the patient, with their family, with hypothermia, so that it's like a 360-degree approach we give. All the maximum natural system of treatment or healing we try to do. And then another very good area is like bone joint and spine related issues. So arthritis, any sort of back, neck, spine, any sort of issues. Those are my core areas. But now the other one, stroke, paralysis, or even immunity related issues. People have a lot of, many of the people are still having problems from COVID, post-COVID complications. Those things can be addressed by us in a most natural manner. Besides that, there is gastrointestinal problems, acidity, IBS, irritable bowel syndrome, or any sort of liver dysfunctions, and where the enzymes are all high, we can definitely help. Wellness counseling, stress-related issues, even metabolic disorders, diabetes, and high cholesterol, high blood pressure. And I try to see things in more not very complicated thing. I try to simplify the problem, because most of in my 19 years of experience, what I have seen is the most complex problems have very simple solutions. So I try to tweak those simple things and find out what is the pain point or where is the prick point, and we try to modify, or we try to just fine tune those things. And it has really, really helped people, because I don't like to give a lot of medication, 5, 6 type of tablets or capsules or syrups. I don't like to give. There are hardly 2 or 3 or 4, because the core issue is something else. Until unless I get the core issue, I will not prescribe the medication. So we have to really, really dig deep. We have to get into the psychological level. At times we have to give financial awareness. Remember, just imagine a doctor giving financial awareness to some patients. Yes, because I need to find out, like, that might be the problem. So here we are not only talking about only just medicine, doctor kind of a thing. We are like a family friend. We are like a friend, and we try to understand, help the person in the best possible way. Okay? Skin problems, psoriasis, eczema, these are very, very strong areas as far as Ayurveda is concerned. And we can definitely have a very good thing. And ADHD, I have not put in, I think I forgot, ADHD and autism, that is another very strong area. So I am finding a lot of positive things in now cancer, along with, thanks to Adipo. We are doing a lot of things together. My 100 patient, one patient, she was in 3rd stage, 3C, and she got recovered completely, 100%. And that was the first case here, what we handled in 28th of February. And another 3-4 months, she's absolutely clear. So that actually motivated us a lot. So we were still finding out, more patients here. And now I think around 5 patients, so we are doing on things. There are some cases in which the tumor markers are all coming down. So it's not I am doing the whole thing. No, it is like joint effort. It's like the onco doing their work, I do my work, hypothermia is doing their work, and of course the familial support is very, very imperative. It is supreme. So likewise, we do all those things. So what are the key takeaways from the session? I'll be talking about what is Ayurveda, basic principles, concepts, why disease occur as per Ayurveda and how we treat it, how to prevent, and some formulations, what are product range and all those things. Believe me, this is not a product selling session just to make you more and more aware. That's the only thing that we are trying to promote. So now let me see, like this data, it's a old data, almost a decade back. So this is, there are some more data that are coming up now. I'm just trying to compile. There were 2000 to 2015 when they did a study, as per, they say the cirrhosis of liver, that was in number 10. The top 10 ones, let us see. Next was, of course, tuberculosis. Next is diarrhea. Then, of course, Alzheimer's is number 7. Diabetes is number 6. And number 5 is basically respiratory cancers, which are there. 4 is chronic, like asthma and all, chronic obstructive pulmonary disease. And then you have lower respiratory tract infections. Second is stroke, and number 1 is ischemic heart disease, or the heart attack people get. So these are the top 10 ones as per 2000 to 2015. But there are a lot of data that still I'm trying to populate, and it is not to scare anybody, but just to say that, these are the majority of the things, what causes mortality in people. So we as people, as doctors, as physicians, we have a very, very big role towards the society. It is not just going to the hospital and prescribing some medicine. No, we have a very, very, very big commitment towards the society. Because in India, there is a different story. In Malaysia and Singapore, there is a different story. Almost like a year, I'm traveling with Malaysia and Singapore. Fortunately, unfortunately, I'm finding out that, the dearth of giving that personal touch to the patient is not there. They don't see the patient. And many times, they will be giving 3 months, 4 months medication all of a sudden, and the person is always on those medication, whether the person requires it or not. So it's for that reason we have to be going very, very slow. We have to pace ourselves with the patient. It's a very, very personalized thing, and we cannot play with anybody's lives, because lives are precious, right? So this is what we do. So these are some of the facts that are there. And WHO report 2023 says that 4 major non-communicable disorders, namely cardiovascular, cancer, chronic respiratory disease, and diabetes. They killed about 33.3 million people in 2019 and 28% increase in the year, from the 2000. These are some very, very scary figures, The moment you see these figures, you get a palpitation. So this is how the world is leading up to. So the idea is that, so what is the solution? So the solution could be like, you have to adopt something natural, something which will be going along with your system, rather than just popping pills and seeing the things to be changing. No, it is not like that. We have immense potential to heal, and I believe in that human potential to heal on its own. That is very, very important, very, very critical. Everybody is a healer here. Nobody is a patient total, right from birth. Nobody is a patient. Body has immense potential to heal on its own, and we just have to give it the right medium, the right support, and it will definitely kick back, whatever you say. So we believe that capacity of the body to heal on its own. We are just supporting that capacity. Okay? So basically, what is Ayurveda? How many of you have heard about Ayurveda? Okay. Have you had any therapies or something like that?
Therapy is not what kind of food and things Ayurvedic.
Okay. Food and all those things, yeah.
Yes, massages and like oil.
Okay. That's a very, very, that's a very good picture of, wherever you type Ayurveda and put it on a pictures, you will see massages and you see this something doing here. It is if you see, that was one of the torture techniques of Chinese probably. You just pour head, water on top of the head, and just drop by drop, if the water falls, the person can get crazy. So it was one of the torture techniques. But in Ayurveda, there is a relaxative technique, right? So that I will tell you how. That I will be talking about that as well. So Ayurveda is basically composed of two words, okay? Ayu and Veda. Ayu means, life. Ayu is life. And Veda is any science, any text, any treatise, and all those things. So when you combine both of the things, is like Ayurveda, that is the science of life. Okay? It is one of the most ancient healing techniques. It's a very healing, that means to me, Ayurveda is more preventive than curative. You should not be falling sick, right? You have a lifespan of around minimum 100 years. So that is what your total span is. And it's up to you how to lead that 100 years, probably through disease or disorder or popping pills, or you try to be healthy and, you take care of yourself. So that's the most important part. So it is more philosophy which is preventive. Say 60, if you say 100%, the books and all those things, the principle, 60% to 70% is only about prevention. When they talk about what you should be eating, what time you should be getting up in the morning, what are the seasons, what fruit should be taken in the season, what food should be taken during the season, what should be your daily routine, what time you get up and what time you go to sleep. So when they talk about all those things, it is not just about medicine and all those things, right? So they talk about how you can lead a very healthy life. That means it will be talking about prevention. And if somebody falls sick, of course, you need to do some therapies, to do some decoction, do something, to make yourself well. So that is the whole idea. So 60% prevention and 40% is about curation, right? So prevention is always better than cure. Now health as per Ayurveda, that is very, very important. So in Ayurveda we believe there is a physical health and there is a mental health, right? Physical health is basically how the organs and the organ systems, you have the metabolic, how the physiology is, how all those things, the organ systems as well as your muscle, the components of the body, what are the metabolic functions, that means whatever you eat, it is getting digested, and what are the excretion, that means whatever you eat, digested and excreted out of the body. So this input-output mechanism, everything comes under the physical health, right? And also the mental health comes when we are very spiritual people, you see, we Asians, in fact, we are very spiritual. So we say that, a person told to be healthy is when the person, the soul is healthy, the sense organs are healthy. That means the eyes should see what the eyes actually should be. It should not be something virtual. It should be like real. Okay, there should be the sense of smell should be working out fine. That sense of taste should be working out fine. All those things are very, very important. And of course, when you have all these things, you have a peaceful mind. And of course, when you combine both the things together, you have a complete health. And if you see the definition of health given by the World Health Organization, they said health is a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. That means it is not only about physical health, it is about mental health, it's about social well-being, everything. Now they have started to do economic well-being also. Because you need to pay for your things, right, if you fall sick. So economic well-being is also very, very important. So this was done in 1948. This is from our community medicine book, Parker. So they say that it was coined in 1948. But 5,000 years back, Ayurveda said only these things in a couplet. In Ayurveda, they have couplets. So in 2 lines, they said, if you find A, B, C, D, E parameters normal, then the person is healthy. Otherwise, any sort of deviation, the person is having any disease or problems. Right? So this is how they categorized health. All right? So that means balance inside and the harmony outside. So now I'm going one step deeper now. What are the basic small principles of Ayurveda? So basically, as any foundation, as any building, it has some still structures, right? They have a foundation. So Ayurveda talks about 3 basic pillars, okay? The first basic pillar is basically diet and lifestyle. That's most important. They say first pillar is diet and lifestyle. If you regulate this, most of the things are over. Okay? You will not fall sick. Or somebody who has any problem, if the person is not following a dietary regimen and what to eat and what not to eat, or a good lifestyle, the person will definitely bound to be, like today in the morning I received one patient, and what she said, Doc, I am a very poor patient. I said, what happened? No matter whatever you are going to give me, I will not follow. So I said, then why have you come to me? No, I still want to, I trust God, and of course, I want to try it out. I said, okay, then God has sent me. Listen to me what I'm going to say. So then she said, yes, I will definitely look after it. Okay, because I said, God cannot be everywhere, right? So he has sent me to actually tell you, no, you are leading a very bad thing. Example, you please mend your ways. So she said, yeah, I promise you, then I will try to do. So the thing is that, we have to have a very balanced kind of a thing. Diet is very, very important and lifestyle is very important, right? The next pillar of health is sleep. In my rough assessment, when I take history of the patient here in Singapore and Malaysia, now it is catching up very fast in India as well, 70 to 80% of the people, they have a sleep problem. 70 to 80%, that's a very, very high figure. Whether you have diabetes, whether you have high cholesterol, whether you are stressed, you name it, even immunity issues, you name it, I just find out that they are sleep deprived. Okay, why it is important? Because it is during sleep our body gets detoxified. So that means we have to say, we as human beings, we animals, we have daylight follow, we follow daylight. We are not nocturnal animals. Okay, our metabolism is very much related to how the sun rises and sun sets. So once in that sunset, the entire metabolism, the machinery is taken over. That means you need to sleep. That's how the hormone, which is like the serotonin and melatonin pattern happens. So people have problem and they supplement melatonin drops or something like that. I say, why? I don't understand why. There is no point. You just try to relax and of course you will fall into sleep. But they are trying to take some medication and then only they will be falling onto sleep, which is very, very wrong. So sleep is definitely a very, very major indicator of health as today I'm saying. 70%, 80% of the cases, you will see how many things we try to do. Give the medication only for regulating their sleep and nothing else. Once you regulate sleep, the other things fall in place. Whether you talk about high blood pressure, whether you talk about cholesterol, whether you talk about sugar levels, they all drop down by just regulating sleep. And the third most important factor is, in Ayurveda say, the brahmacharya, ahar, vihar, ahar, nidra and brahmacharya. Nidra is sleep. Brahmacharya is, I say, because it says abstinence, it means abstinence or good. But I'd say that it is a good sexual conduct that is most important. When you are married, so you should have a good physical relationship, which is an indicator of good health, right? So that is also one of the very basic, very good indicator of, so all these three things, three pillars, they support what we call as life, right? So that is very, very important. So in Ayurveda, what we feel that how disease occur, how we say that, the disease are occurring, how? So first of all, there is a genetic predisposition. That means if a person is having some sort of a genetic problem, somebody is having diabetes or somebody has a risk of cancer and all those things. So they have some genetic predisposition, which is accompanied with faulty diet and lifestyle. The F and D and L means diet and lifestyle, plus a stressful life. So all those things are like a very, very good mix for catastrophe. Okay, so you have a genetic, your genes are really predisposed, then you have a faulty lifestyle and all those things, you have a very irregular diet, and of course you work in a very stressful environment or live in a very stressful environment. The second thing what happens is, the next sequelae is basically, your first thing which will be affected is your digestion. You'll not be feeling hungry, or you will be off balance. Things will not be in a proper way. So when that improper digestion happens, the metabolism will be suffering then. Because the input-output, where is the body going to get energy? Okay, one car is blocking the road, I think, JOH 887. Somebody's car, 887. Oh. Yeah, please. Sorry about that. Yes. So that is happening. So once your metabolism goes away, what we feel that a lot of stress chemicals which are like free radicals and toxins, they get on to accumulate inside the system. That will keep on accumulating. Okay? Still, there will be some symptoms, not major symptoms will be throwing up. Then what happens, your immunity is knocked off. Because when the body is high, the hormones which are like the corticosteroids, cortisol, which will be on a high, it will actually push your immunity down. It will, it will lower down your guard. Then what happens, the body is getting vulnerable. It could be any infection, it could be flu, it could be anything. Then of course the body is also attacked by microbes and the disease happen in the metabolism. So what we say, this is very, in totality, if you see, if your diet and lifestyle is maintained, environment is maintained, you can still win over your genetic predisposition. It is not like every diabetic will become a diabetic, every cancer, if you have cancer in your family, you will also end up in getting cancer. So we try to take care in that way. So that is how the disease occur. We say that in Ayurveda. And of course now the treatment methodology, how we do it is basically through three major factors. We say every time you see, the first important thing is food and lifestyle. You correct food and lifestyle. We always hear also the first thing which I regulate is food and lifestyle. Without that, I will not give any prescription. The first thing is, of course, food and lifestyle has to be maintained. If you are able to follow that, then you will be eating less medicines. That is all that I want. So that is all that we do. Then, of course, the usage of herbs, we give supportive therapies, and of course, there are non-invasive therapies. That means we don't do any surgery, but in a way we do surgery. So it's like bloodless kind of a surgery. So it is an non-invasive process in which we root out the toxin, or we throw the toxin out of the body through a process known as Panchakarma. I'll just throw some light on that as well. So Panchakarma means it's a total detox of the body. It cannot be done on outpatient basis. You come down and you take a therapy, it is not possible. It is always in-house. We have to plan your lifestyle, diet and everything, and it is done in a course. So minimum, a good detox will be happening in a period of 2 weeks. 2 weeks time you need to give your body, and of course 2 to 3 weeks it can go, okay, depending upon the case to case. So what happens in Panchakarma? Pancha means in Ayurveda or Sanskrit they means 5. Penta, Pancha, Panch, 5. And karma means actions or procedures. So that makes Panchakarma, okay. So that means it is a therapeutic regimen of rooting the toxins out of the body through the nearest natural orifice. So anything at the cardiac level, at the stomach level, it has to be coming up. Anything below the stomach, so we can root it out through purgation or through enema and all those things. That is how we deal with the thing. That's the reason I said it cannot be an OP procedure. It has to be an inpatient procedure, right? So basically what we do is like Purva Karma means in that we prepare the body. Now I want to stress one thing, that means we do an oleation, that means oil therapy in which we massage the body and increase the temperature, fermentation. In my 18 years of my career, I have never understood why we give this, why we give steam, why we increase the body temperature, why we, give this steam chamber in a steam bath, why we did it, why people used to do it. I never understood till I met this team. Because they are doing hypothermia. So why hypothermia? Then they only actually, I knew the basic principles, but the reason is he gave me a very, very scientific definition for it. Because why we get fever? It is very important. Fever is one seminar when he was talking, and after I gave my Ayurveda, this thing, Mr. Isaac came to the stage and he said, you should celebrate when you get fever. And I was like, what this man is saying? Celebrate? So we get down, right? We don't celebrate when we have fever. Actually, yes, we should be celebrating when we have fever because your immune system is still active. It is trying to fight pathogen. Whatever is the pathogen or whatever is the problem, it is trying to raise your immunity. And in Ayurveda also, when we were studying pathology, the biggest chapter, the most thickest book is about fever. I never understood why fever is so important. Then, because this is a journey, this is a learning that after almost 18 years, this revelation is coming to me. No, fever, why fever is the biggest thing? Because, what any small thing or big thing it is come, the first symptom which will be coming is fever. The body is trying to increase the temperature. So, it will increase the temperature immediately. Any sort of bugs which are there in the system, they will not multiply. Our immune cells will come, they will kick it up, and of course, they will find out ways to root out it, kill it, and all those things. That happens. Exactly this is happening, though we were giving these therapies, but here the therapy is given in a different manner. But the principle is just the same, increasing the core body temperature by 1 degree, 2 degrees, 3 degrees. That is the learning that I had. So this is where I can see how hyperthermia and how Ayurveda and all those things are, the ancient wisdom, how it is given a modern scientific definition today, and it is documented, it is given the way that how a person is treated. So this is, I just wanted to put it out, say hyperthermia, this is our form of ancient hyperthermia, you can say. And what you get here in this machine, which is one of the good ones, there's a focus and localized kind of hyperthermia treatment, right? The next is, of course, the main treatment process. So this is where you see, as I told you, like any toxin which is there at the stomach level, we try to root it out through emesis or through vomiting. We feed the person with, feed the person with, milk or hot water and all those things, and it will go, and we do a local irritation, and the person vomits out all the things. Then, of course, the next process, karma, the second karma is, of course, virechanam, in which we give medicine, the person purges out. The third is, of course, vasti is medicated enemas, which it's like colonic cleansing. We are cleaning the whole colon. So that is there. And fourth is, of course, nasyam, which is like we instill the drops inside the nose. So if you see, you said, you can say, Danny, you said about there are 5 karmas, but I can only see 4 here, which is the 5th one, right? I told Panchakarma means 5, right? So 1, 2, 3, 4 is only. Where is the 5th one? Pardon me? No. No. See, the thing is, this is 1, this is 2, and medicated enemas, basically there are 2 types of medicated enemas, hypertonic enemas. One is basically decoction-based enemas, which has more water base, and the other one is basically oil-based enemas. So there are 2 different types of enemas, and of course, the nasal insufflation, that means we'll be instilling the drops inside. So if you see, and you can ask Danny, if, if morning somebody gets vomiting and evening somebody can get, this purgation, next day some, this vasti, the enema and all, it is never given all of a sudden. The person will die. So it is always given in phases. So that is all up to the doctors to see through which route we give. The safest, if you don't understand anything, what Ayurveda says, the thumb rule says, you can give vasti, that is the enemas, because the toxins will be mostly in the gut. So you cleanse this. If you don't understand anything, you only give this. It's a tricky process, but you give this. This is half of Panchakarma treatment. They say this is half of every treatment. The whole Ayurveda treatment, this is half of Ayurveda treatment. But it has to be given very, very meticulously. Otherwise, it can cause problems, abdominal problems for people. Why? Because gut has its own nervous system. When you say, no, I have got a gut feeling. Why they say gut feeling? Right? Why they can't say, oh, I have got a feeling here? You say, no, yeah, I have got a gut feeling. That gut feeling, because gut has its own intelligence. It has got its own nervous system. And it is wise enough to actually guide you through. So it is not only everything in the head, but of course your gut. So that's the reason we believe that if you want to treat a person, you treat the person's guts. It is more than enough. Okay, because digestion is good, metabolism is good, your input-output mechanism is okay. So they are like Excel sheets. How many of you work on Excel sheets? You know why? But the beauty about Excel sheets is that if you give a good input, you can get brilliant output. So you can see the data, all those things. You can do a pivot. You can do, I don't know what all things you can do. But if you feed the trash from the input, it will only generate trash. Same thing, our system, our body is exactly like this. If you feed good things, good thoughts, good deeds, it will all be there, and the output will also be good. So that is the key learning out of this. Okay? Then, of course, as we say, after Panchakarma, after the main treatment process, we actually plan the diet, lifestyle, herbal therapy, and all those regimens, and we lead the person back to their lives. So that is how it goes. Now, I want to delve a little bit more deeper and how we give Ayurveda formulations. So just wanted to let you know what are the various formulations, and you might be knowing about it, many of them. Yes?
What was the fifth one for the Panchakarma?
Panchakarma, you have Vamanam, that is emesis, Virechanam, purgation, 2 types of enemas. Okay. Medicated enemas, and fifth is Nasyam. Okay? To some people, some text we say the fifth karma is, of course, instead of Nasyam, they say bloodletting. You have they will do small nicks. They will be pulling out the blood, cupping technique and all those things. They will be sucking the blood and all. Or even leeches, application of leeches. That is also done. So in Ayurveda Panchakarma, that is also there, one of the fifth karmas. If they are not giving Nasyam, that can also be given. But that is people who practice surgery, people who are a little bit more on a different path. Okay. So in Ayurveda formulation, how we used to give the medication is very important. So these are the various formulations, how we used to give. Swarasam means it's you take ginger, you just put it on, you just pound it, you get juice, right? Or you have lemon, squeeze a lemon or squeeze a lime, you get fresh juice. Fresh juice is the strongest form of any medication. It's very, very strong and it affects very fast. Suppose if you have indigestion problem, so suppose you do one thing, just take ginger and just a small piece of jaggery or anything. You just pound it nicely, you eat a little bit this ball of this, and your chest or stomach will absolutely be clear. So it's very, very simple. So it is the strongest form of any medication. But the problem here is that it has to be consumed fresh. So you can't keep a fresh juice for say 4 hours, 5 hours. It gets oxidized. It will not be of any use. So then what they did is they dried. So they dried the ginger, and then those powder format was there. They just pounded powder. You just mix it with water, and again it will be like the fresh juice kind of a thing. The next is decoctions. We call it kashayams. That means liquid decoctions. You put a herb in water, boil it, reduce it, and that is a water extract of the product. And we call it kashayams. Kashayams are like the aqueous extract. Then of course arishtams we call it. Those are alcohol. So whatever things are water soluble, it will be taken in this liquid decoction. Then comes the alcohol extraction. You see homeopathy, they make all the tinctures in alcohol, right? They will be having alcohol, they'll be taking tinctures. So in Ayurveda also, we prepare sweet wine, you can say. So in that, whatever alcohol soluble, the components are there, that can be taken in arishtams. Next is, of course, ghrutams and thylams, which means they are lipid-based or fat-based or oil-based preparation. That means whatever components which are soluble in lipids or fats, that will be taken in this format. And the last one is basically jams or paste. You can have Chyawanprash, you might have heard about it. So they are like jams. So you can just take a spoonful and go. So these are the various formulations that we were seeing. We were doing in the traditional form of Ayurveda. Now, why we opted for different thing is because now what there were challenges now that we, as a doctor, as a physician, I was facing challenges. Because I cannot give these decoction. Today, people hardly, because of the taste and other things, people will not be taking decoctions very easily because they are bitter to taste. Or if they are traveling, how can they take 2 or 3 decoctions, put it in a pocket and they can go? It's very difficult. So my patient compliance was becoming weaker and weaker. So if I prescribe them medicine for a week or say a month, the medicine which were much more tastier, that will be finishing faster and the decoctions will be left at the last. So what happens, people are not taking the full dosage of medication. So that was there. So what we found out, the availability was very, very important because all the herbs are not available today because of deforestation, a lot of other issues. Availability was not there. Second is the manufacturing processes. See, all the manufacturing processes, any medicine, Ayurveda medicine company you go, they have a manufacturing process, but that is all standardized. But the medicines or the herbs are not standardized. That is very, very critical. The quality issues was there. Then third is, of course, ease of administration, as I told you. Is it easier to take a capsule or a tablet rather than drinking a liquid, right? You find it much, much better. So similarly, we try to do that. I was finding a problem. So ease of administration, that was a challenge. And second, and the last but not the least is, when we think about globally, when we are trying to do Ayurvedic medication, export and all those things, we cannot have all the drugs which will be passing their quality and their Ministry of Health. There will be some drugs will be like, they have categorized as poisons or, all those things. So we are unable to give all the traditional medications, we will not be able to bring them up. So these were some challenges that we faced. So what we did is we formulated BioE Life Sciences. That's how our 2021 we formed this company and we then brought down a range of products which are all high quality extracts. Okay, they are all high quality extracts. If you want to take, I say you take 1 teaspoon of turmeric, this turmeric. Instead of that, I can give you 125 milligram of curcumin in say 1 capsule. So it was doing out fine. So what happened then, we had the patient compliance, the patient were taking full dose medicines, the quality of the person, I was not giving a lot of medication. Most of my prescription came to almost 50%. And the patient's quality of life get to improve. We see the basic parameters, the lipids were coming down, even the cholesterol and all those things coming down. Their diabetic medications, what they were taking, that was almost halved. There were some people, who were totally out of medication after 3 months or 6 months. That is, I'm not saying, it was all their allopathic medications that was stopped by their doctor. I did not stop anything because I am not permitted to, I am not entitled to, I will never do that. By ethics, I will not be doing it. Instead, their own GPs, after seeing it, they reduced it. I have a patient in Johor. She is 75-year-old. She removed 1 kidney. So she is surviving with 1 kidney and she was having a perpetual problem of recurrent urinary tract infection. And the doctor has given all the antibiotics. Whatever they could, they kept on giving her. She was feeling very miserable. And around 8 months back, I started to give her very basic medication. Within 20 days, entire UTI was gone. She immediately ran to her doctor. She said, no, I don't want any medication and all. The UTI is all fine. The doctor said, is it suiting you? She said, yes. You're feeling better? No more infection or no more burning urination and all? She said, no. They did a culture and all those things. Okay, fine. Then the doctor said, you'd better to take that medication and that's it. But I was very careful because she is surviving with only 1 kidney. So we have to be very careful with patients. So I kept her on a very least dose. And for the past 8 months, she is feeling well, but she is on and off my medication. I give her some medication, she'll be well, then she'll be off. But certain times, for 6 months, continuously I was monitoring her. Then I gave her a 2 months break. Then again she came back. She said, yeah, I'm doing good. There's some small symptoms here and there. So we try to manage in that way. So these are the very important facts that we have to see. Next is, of course, these are the range of products that we have. We have Can-Fi for cancer and Comfresh, Cardim for normal cardiac functioning and all those things. Dia is for diabetes, Immuno is for immune boosting, immunity, Joint is for joints, and FitCR is basically for natural weight loss, weight management basically, not waist loss, I'm sorry. So weight management. So what we do is like these are all high quality products which are all under prescription. It is not available across the counter. No, we don't want to do that. Because it was very easy, it could have been very easy, we could have found a distributor here and they could have done it, but no, we wanted it to be kept strictly under prescription so that it doesn't, people don't overdo things. Here MLM, whatever they will be taking pills, just taking it down, and after a month or 2, 3 months, they say, no, it is not working and all. So that thing we don't want to do, okay? So we are very, very clear on those, what to give. And we are managing our show with these 8 or 10 products. That's it. I don't require 200, 300 range. Only these 10 products are required along with diet and lifestyle. That's it. Right? This is our range of products that is there. This is just for display. Okay, I just wanted to bring it out. One thing which I wanted to say, this is our latest product on cancer. We are giving as an adjuvant medicine. And Can-Fi, we have done almost like... Thank you, sir. What happened? This gone, huh? Sorry. So Can-Fi is basically, we have the idea came to us because we have a very eminent oncologist in Madurai in India. So this gentleman had done a small research, a small study with a group of around 40 patients of various cancers, and he tend to see minimum 100 cancer patients a day. He's a very, very busy gentleman, Dr. Jabbar Singh. He's a very, very, very down-to-earth individual. Sees 100 patients. If I went to his hospital and I had to wait for around 15 minutes for to meet him. The moment I went in, there are 3 other doctors seeing the patient side by side, and this gentleman is like having another 2 patients sitting there, and he's just seeing, because 100 patients a day is like a very big load. So he has already done a study of around 40 patients, and okay. Last, kadesi slide. Thank you. So he was doing this kind of study, and that actually promoted us to actually give it a go to all our cancer patients and things like that. That's the reason we brought this particular product, and it has basic 3 components that we are working on. It is not over the counter. Please, just wanted to say that how important or how credible this product is. We started with there are 3 major components. There are around 8 herbs inside, but we focus on major 3. First is spirulina. Spirulina, everybody knows about spirulina, how it acts, and it is a superfood, and it is like it has more iron than equal quantity of steak and all those things. It has more calcium. It has got more vitamins and very, very rich in antioxidants. So it has C-phycocyanin, which aids in cell death naturally. That means the cancer cell is killed by C-phycocyanin in a natural manner, because it will be going and acting on the mitochondria, which is the powerhouse of the cell. Say if I want to switch off this laptop, all that I do is like I can just take the plug off. After some time, the power will go away and it will be switched off. It is the same manner. So you work on the mitochondria. So it will arrest first, it will arrest the growth of the cell. Second is it will work on the mitochondria, so it immediately helps in cell death. I'm talking about only the cancer cells. Okay. The second is, of course, curcumin. Curcumin is we use the keto form of curcumin. So what happens? It will be arresting the cancer cells. Of course, It reduces inflammation. The third product is, of course, superoxide dismutase. Superoxide dismutase is the highest level of antioxidant. This is available on earth right now. You know where it is found? SOD? Anybody? Where exactly is superoxide dismutase found? You know this melon? Musk melon? You know, Japanese, you get at least, sometimes the musk melon is so pricey, you know, they will be selling $100 a piece. $110 a piece. Musk melon is very rich in superoxide dismutase. So we extract SOD from there also. And so what, lycopene is found in tomatoes, you know, the berries and all. Lycopene is there. Astaxanthin, resveratrol, it is a rejuvenator. So what happens when I am giving this product, when I am giving this medication, along with oncologist, that means chemo or radiotherapy, the body's cells, you know, the natural cells will be dying. You know, the good one will also be taken care of. Like it's a war. So you are burning the tissues up in that way. So there is a war. In that war, the good tissues will also die. So what happens? You tend to have hair loss. You tend to have other metabolic disturbances once you are taking these. So astaxanthin, resveratrol, and lycopene, it tries to prevent the bad effects of chemo or bad effects of radiotherapy. One day I was reading, I was just surfing the net, and over Facebook there was a very interesting video that was going on. I'm not very sure to say that. So they were talking about astaxanthin and resveratrol of the eyes of zebrafish. Yes, it was having more of spirulina and other weeds, which was having, and it was having a persistent problem of their eye and the optic nerve and all those things get damaged. So they were constantly feeding on these things, and their eyes and nerves and everything was rejuvenated. So that's how they found out these, yes, astaxanthin and resveratrol can be actually helpful. And also these weeds can actually, you know, the spirulina and all those can help in rejuvenating the whole body. So I'm not very sure to say any claim, because I read that, you know, there was something going on. The people in the pharma industry, they might be suppressing this. I'm not very sure. So it just came to me as an information. I'm just sharing it to you because I am not, I don't have any credible to authenticate that particular thing. But yes, then I said, yeah, we are also using that. We give astaxanthin, we give resveratrol, and of course, it is there in Can-Fi in our product. So this product has been made, and we have found very, very effective results in terms of lowering the cancer markers and all those things. And this is some people ask, oh, can I take this Can-Fi forever and so that I can be off cancer? No, this medicine is specifically as an adjuvant for cancer only. We have another herbal supplement which is for basic your daily use. You can use something like that. We call it as Immuno. It is a smaller version of Can-Fi. Can-Fi is like say you have iPhone 13, iPhone 14, like Pro Max. So he can say Can-Fi is Pro Max of Immuno. So it is in that way. So it is not recommended to take this medicine as a prophylaxis or as a preventive medication. So patient trials, we have done this with Dr. Jabbar Singh and all. So summary is like, now I'm just coming, this is my last slide and then Indu will take over. So summary is, understand your body, listen to it. These are some general tips I give it to all my patients, I tell it to them. See, nobody gets a heart attack the second day, nobody gets a liver failure the third day. There will always be signs and symptoms, you tend to ignore it. Please don't ignore such things. Seek medical advice, go to a doctor. You see something is wrong, you have to be sensible towards it. Okay, that's more important, and sensitive toward you. Regulate your current diet and lifestyle. That is very, very important. Diet and lifestyle, as I say, that it makes the maximum of my treatment and with the patient. And of course, moderate level of exercise, it actually helps. Say low intensity workout like walks and all those things. It creates a lot of positive things inside the system, and the system is all charged up, and that's how things are. Regulate mental stress. This is like something which is very highly subjective. I don't know how much stress a person will take. So based on that, you try to regulate and the stress levels. And another one major factor that I wanted to bring it out is water consumption. Here, almost like 70% of my patients, 70 to 80% of the patients, they don't know how much water to consume. Here, when I go to have food also, people drink more tea or more coffee, hardly any water. I've seen that. They don't drink water. There is a simple formula for it. So say normal formula is that 3 ml per kg of your body weight. Okay? Just to say if you are 60 or 50, say 50 kilos into 3 ml is 150 ml and the number of hours that you work. This is a very, very generic formula for water intake. And water is very, very important. It doesn't have a lot of nutrient value, but it works on enzymatic level. It keeps the body hydrated. It keeps the whole, right from your blood, everything, your skin and all those things is all taken care of by water. A lot of people have constipation. They don't take enough water. So I just have to say, how much water are you taking? Oh, doc, I don't know. Hardly one small bottle or say if you are not hydrated, you will be definitely dehydrated. Constipation will happen. So if I improve the water level, immediately the constipation improves, right? Next is very important. Our body is a gift of God. Please don't abuse it. Do regular medical checkups. And of course, the state of the body. And of course, seek timely help in case of need. So we are all friends here. We are all family. Please don't shy away from asking questions and all those things. We are here to take care of you. We have a lot of responsibility towards each and every one person in the society. With this, I thank you. And any more questions? I think if you have any questions, you can ask me. I think in around 2 minutes, we will just take up any queries. Yes, sir. You please seek my advice. Okay? After the session, you can ask me and I will guide you through any sort of this thing is there, whatever medication. Because it's, as I told you, these are all prescription products. It is not over-the-counter products. We have to see, we have to choose what is good for the person and what is bad for the person. Right? Any more questions, please? Pardon me? Detox?
Stay in detox.
Okay, stay in detox in Singapore?
Is it in
I would love to
Singapore
put up a place here, but I don't have that kind of money. Honestly. But basically, detox and all those things, we do a mild level. You can do it at home. I can guide you through. But on a serious note, if you want to do it, I prefer doing it in, some good place in Kerala. Coming over will be better because I cannot bring my therapist and all those things. Singapore has a very, very tough this thing. First, to get a place is costlier. Second is get a therapist, the quota and all those things. Alan sir was mentioning 1:10. If I employ 1%, 10 local people have to be employed. Where am I going to get that money from? And after all, I will be then going and charging you that kind of money, right? Ultimately, you are the payee. So we want to keep it like in our telemedicine, we wanted to keep, how we kept it so low on price, that my consultation fee and all those things is basically because we don't have any overriding costs. We are passing it on the patient, no? That's how. But definitely love to have a center. It will happen because thought processes are all like that. We will definitely have a facility here. In God willingly, it will have. Yes, but I don't know. It can be like 2 years, 5 years, 10 years down the line. Thank you. Any more? Yes, ma'am. No. If somebody is having cancer, then immuno is enough. No, sorry. I'm so sorry. Canfi is enough. Immuno is not required. Immuno is for general public, people who have some immunity issues and all those things, they can take. But Canfi specifically, we have made it for people with, as an adjuvant for cancer treatment. It works on all the forms of cancer except blood cancers. It is not working on all the cancers except blood cancer. It works on everything. Okay, how to get it out, right? See, if the tumor is shrink in size, we work with the surgeons and all. They can excise it and they can get it out. No, without surgery, if the size is very small, it is not causing any major problems to the person, so let it be. Body can, it will encapsulate it and will keep as a small packet, like oyster keeps the pearl. So let that pearl be inside you. Or it can be removed also, but that all depends. I am leaving it to the judgment of the surgeons and neurosurgeons. But we will try to reduce the size of shrink the size of the tumor along with them.
Early stage, it comes with radiotherapy and then...
Yes, we work along with them.
Let's say the patient
It's completely patient's choice, sir. We don't force. We don't force things. What we have seen is at times you need to take some very stringent actions. Suppose the cancer is very aggressive, so you have to give. That is what we are also finding it out. It's not like I will say that please don't take this, please don't take. No, we have to take, because the first person will not come to us directly. They will be already taking this oncologist therapies and all, whatever chemo and all those they will be taking. So on that we are coming as a supplementation role. We are coming as a supportive role only, not the main course of treatment, because I have very few data to supplement my claim. I don't want to claim today, and I don't. So we are not claiming in that way. We work along with them, because every science has its own strong points. We have to work on that science, strong points.
Because about just listening something, we even listen his talk and all that.
Yes,
So
Jabbar Singh sir. Okay.
even we communicate. So we never go for any radiotherapy. We never go for anything. We just went for strict diet.
Of course. See, first thing when I see a sugar patient, it's a cancer patient, I say, please stop sugar. The first thing is always stop sugar, because a cancer cell takes more than 20-25 times more sugar than any average cell. You cut down, you starve the cell to death. Then, of course, there are other things. But, at this moment, what we do is, we are not challenging the other science. We are working with them, because they have their strong points. We have to give their judgment. That side, we require their help. We are trying to do an integrated work, rather than, no, you don't come to, because we know some dear friends who have only received, say, immuno and other therapies and all those things, and the very, very costly therapy. And ultimately, one patient of mine, he received, all those things, and now doctor initially said no chemo. Now the person is going for a chemo now. He has been given, and he was scared to death. He was told it has already gone to the 4th stage. You have to go for thing. It took me 1 month to actually bring him to a certain level, where I made him accept his condition. Of course, he was getting better. Suddenly, one visit to the doctor, and immediately everything got. Then I have to spend almost 3 hours to make him understand. Please don't worry, we are there. So it's very heartbreaking, because every case of mine is very, very unique, very personal. And I say you can fight with cancer with everything, but yes, you need an attitude and aptitude for it. And healing is there within the person, and the person has to believe here. It has to be mentally very, very strong to deal with that. So when I am trying to boost their that mental strength, the other side of the doctor, no, I'm not I'm not fit to comment on them. They have their ways. He was told that he has only a few months to live. Just imagine, if he has around 6 months to live, he will die in next 2 months. So please don't do that. So you work with people, and I say it has to be dealt with a more sensitive way, rather than just going by facts and figures. I think we have to deal with our cancer patients and people who have chronic problems with a little bit of heart, rather than just cut right and be very, very this thing. I don't know. It has to be done in that way, I feel. But I am not fit to comment on other systems. But this is our way of doing it. We approach the patient with a lot of love and concern. That first thing that we generally do is make the person as a part of our family. So when you are in family, you don't have any fear. No, I don't wear a white coat and sit for consultation. Have anybody seen there are patients, they have never seen me sitting with a white coat. I'm already sitting in my normal shirt and all those things. I meet them, greet them, and we laugh, and then you see like Gomati madam, that the day her mother came, her blood pressure was almost 205. And the systolic was 205 and the diastolic was almost 180 or something like that. So I just make her sit and all those things. We chatted, we cracked some joke. After 10 minutes, again I measured her blood pressure and shown her. So she relaxed, because patient is coming. They are very scared. Next door, who is sitting? Is it a tiger or a lion or a bear or what? So it happens. So when the patient comes in, we don't have to be intimidating. We have to be very relaxing, very calm. We have to welcome them now. So a lot of things I have learned almost these things in my 19 years of career. That's how I have dealt. I'm not very sure, but my patients are definitely happy. That is what I am standing here in front of all of you. Right? Any more? Yes, ma'am.
I'm sorry, I
Yes.
have another 2 or 3 questions. Is it okay?
Yeah, please.
Very sorry. Okay. I saw your product. It's okay.
Yes. Yeah.
Okay, sorry. Okay,
saw your product by the name of Fit. For
Yes,
the weight.
FitCR, yes.
Yeah, can you explain about that?
Ma'am, FitCR is basically what we do, what we use it for is weight management. And also it's like a metabolic booster, you can say. It improves the metabolism. And there is a 20-20 rule that I follow. That means you will take 20 minutes to finish off your meal and you will chew 20 times the food.
Okay, is it about weight gain or lose?
No, it is basically about weight management. I did not say about weight
Yeah,
loss.
I need to know
It's
that.
not about weight loss.
Okay.
Basically, we are all born with certain, fat mass, muscle mass, and all those things. It's all highly individual. Like, we cannot have the same measure of body mass index for a Westerner and an Indian or an Asian. We all different. If you say on a body mass index, if you take, so most of us Indians or, we are already into that borderline obese or obese and all those things category, because our muscle mass and the bone mass is different, right? So what Fit has, the Fit CR is, it has got Garcinia cambogia. There are some herbs which are there, which improves the metabolism. And it will try to bring it will improve the digestion, metabolism, things, which actually helps in the weight regulation. It regulates the weight. And a person who is always watchful, definitely the person will be coming back to a normal state of health. That is what the whole idea is. It is like a metabolic enhancer, you can say.
Okay, that means the nutrition absorption will
Yes.
be good.
Hmm.
Okay, so that's fine. Thank you. And can I know? I saw your food, the diet chart.
Yes.
Is there any restriction on foods for cancer patient?
First is, of course, sugar, that is there. And for food and all those things, I have a very good colleague here. You can see that beautiful lady sitting there. She is my colleague, Krishnendu. She'll be talking about the food and cancer. So she's coming to your question. But actually speaking, with the kind of present set of things, with cancer patients and all, I plan very, very limited diet restrictions. Only sugar is my concern. I just cut it off. That's the only thing. Yes. Crystalline sugar. Yes. Fruits, they are more or less fructose basically. They say that, you have to even cut down fruits. But I say, it's a very dicey thing, See, the thing is what happens, person, if you're taking the sheer joy out of a person, why are you killing that person just like that? So a small piece of mango, if the person is getting joy, I don't mind, you please take it. But don't overdo things. Don't overindulge. So if a person is taking, I say instead of just taking a whole mango, the person can go for a fruit platter, which can have pears, which can have a little bit of apples, and a small piece of, mango also. I don't mind. And even better is, we say that complex carbohydrates will be, where a person is taking, they'll be eating a little bit of rice and other things, that will be there. But taking complex carbohydrates is okay, rather than taking refined crystalline sugar and all those things, which I say you please cut off. So that is, on a safer side, it is like that. Okay, I hope, yeah, okay. Any more? Yes, ma'am.
About Ayurveda, the products related to Ayurveda, right? How about fasting? Is there anything related to fasting in Ayurveda?
Yes, that's a very, very big question actually. That's a very, very big question. Basically, when we treat a patient, say fever, they say, when you have fever, you don't have to do anything. Just leave, you fast. The fever will be okay. Okay? Fasting is a very important treatment regimen. If you have some small symptoms and all those things, they say you fast first. That's it. That is the same thing. It is extrapolated. Now you have various fasting techniques. You have intermittent fasting, which I also practice intermittent fasting before I came here, because otherwise my friends are not leaving me here. They take me to breakfast, lunch and dinner and all those things. I am out, of my regular intermittent fasting. So I've been practicing it since February this year, because when I started to go for patients and all, I said, let me also try it first. So I tried intermittent fasting. It's beautiful. It's really, really helping out. And I don't feel any sort of, lack of energy and all. I am fully energetic. I'm fully very, very active, rather than I was earlier. When I do a measurement of myself earlier and say post-February, I am feeling a lot of change. So fasting is definitely important. Fasting, the interval should some rule says that when you fast is, how you fast is, that means the food that you have eaten, it should be digested and you should be feeling hungry to have a food again. Okay. Otherwise, you don't put it in a regimen, say breakfast, lunch, dinner. So 8 o'clock, 1 o'clock, 8 o'clock. So that is not the case. Eat when you are hungry and eat very slowly. In Ayurveda, there are rules how you should be eating the food. They say that food should not be eaten very fast. Food should be freshly cooked. It should be having all the proper measurements. That means the carbohydrates, fats, and proteins. They should be there. And how much food you should be having is, you have to fill your stomach 1/3 with solid, 1/3 with liquid, and 1/3 you leave it as such. Because 1/3, that means if you're eating something, then you feel, yeah, I can take one more, say, something else, some more rice or something else. At that point, you just stop yourself. That's the reason they say 20 minutes, it takes 20 minutes to take your food, because it takes 20 minutes for your brain to send, stomach to send signals to the brain that you're full. Because it is all, satiety center is very sensitive, which is there in the brain, is sensitive to the glucose spike. So if you are eating the food very fast, you will end up eating a lot. But if you are eating it slow, the digestion will start from the mouth, because the salivary amylase will be working on the starch. It will be sugar will be going to the stomach, it will be absorbed, getting into the blood, and this blood will be circulated through the heart to the brain, and as it comes to the brain, it takes minimum 20 minutes, and the signal will say, oh, you have reached to the peak, please stop. You eat a bowl of rice in 20 minutes. I am telling you, you will not be able to eat slowly. And as I say, 20-20 rule, take 20 minutes, and every morsel that you take, chew it for 20 times. You will never be eating extra. You will never be eating extra. Mark my words. You try it at your home, and my email ID and all those things are here. Please give me a feedback. Okay? I hope, is it okay, or we will take some other things because Krishnendu is anyways waiting. Yes, sir?
Intermittent fasting, how often do you do that?
Sir, I do it on a daily basis. It's nothing. I follow a 16/8 rule. 16 hours of fasting, 16 hours of fasting, and 8 hours of, whatever food and all those things. 16 hours, how I do it is, what I do is, like, I have 11 to 8 or 11 to 6 kind of a pattern. So I only do in that way. So 6 o'clock, beyond 6 o'clock, I don't take anything. I just leave it. So next day morning at around 11ish, I'll be feeling, because I have regular consultation and all, then I'll have something, carrots or something, salads I start, then I have something at lunch. So that is a pattern that I follow, and nothing beyond 6 o'clock or 7 o'clock. I don't do that. So, but it happens, we are all humans, even though a doctor or whatever it may be, you are also a family man. At times we have to go off guard. But yes, that we will try to bounce back in that way. So that's how. Thank you so much.